Hey, my name is Madison, and I'm going to be performing Foley insertion and catheter care. First, I'm going to identify my patient and verify my physician's orders. Then, I'm going to verify if my patient has any allergies to shellfish or latex. Then, I'm going to wash my hands, put on some clean gloves. First, we will perform perineal care. I need to make sure that my patient is in a comfortable position. The female should be in dorsal recumbent position and the male should be in supine or Fowler's position. I'm going to uncover my patient. Put down a waterproof pad. Shiny side down. And I'm going to get lukewarm water and some soap, and then I'm going, for a female, I'm going to wipe from front to back, and then if it was a male, I would retract the foreskin and then clean around the urinary meatus in circular motions 3 times towards the shaft. Okay, after I perform perineal care, I'm going to take off my gloves and then wash my hands. I'm going to get my Foley catheter kit. And then I'm going to open it away from me, maintaining sterility. I'm going to take out my sterile gloves and apply those. Okay, once my sterile gloves are on, I can now place the drapes on my patient, shiny side down. I'm going to do this one first. And then I would ask for help from another nurse to lift my patient so that I'm maintaining sterility. I'm going to drape this on my patient. And then I'm going to set up my sterile fill. I'm going to take my saline and attach it to my catheter. And place that to the side. I'm going to open my lube. And discard of that. And then I'm going to open up my alcohol and discard of that. Next, I'm going to place my catheter tip into my lube. For females, I would lube 1 to 2 inches, and then for males, I would lube 5 to 7 inches. So I would place that in the lube. Next, I would begin perineal care with my betadine, cleaning in the same manner that I did with perineal care. And then once I use this hand to open the labia, this is no longer sterile. I'm going to wipe from front to back. And then in the same manner, I would also use for the male, I would retract the foreskin and clean around the urinary meatus 3 times towards the shaft. Once I've cleaned, I can now insert my catheter. Can you please bear down for me and take deep breaths? For the female, I'm going to insert it 2 to 3 inches, and then once I see urinary return, I'm going to insert it another 1 to 2 inches. And then for males, I would insert it all the way until the bifurcation. So I've seen urinary output in my catheter kit. I'm going to secure the catheter with my non-sterile hand, and then I'm going to inflate the Foley bulb with my 10 cc's of saline, and then I'm going to discard of that, and then I'm going to tug until it meets resistance. Okay. Next, I'm going to secure the catheter onto my patient's, for a female, upper thigh, and then for a male, the upper thigh or lower abdomen. I'm going to make sure my tubing is not kinked. And then I'm going to place the catheter on the bed and make sure it does not touch the floor. And then I would secure it with tape. And next I'm going to take off my gloves and then wash my hands. And then I would document the procedure, the patient's tolerance, the type and gauge of the catheter. I used a 14 French Foley catheter, and then I would document the appearance, amount and type of urine, and if there is any odor, and then the time of catheterization.